Hi, my name is Ashish John. I'm the Dean of the Brown University School of Public Health. And today I'm very proud to join you on this fifth LANCET countdown on climate and health. Climate change is the biggest threat to human health, and the effects of climate change are affecting human health across the world right now. Whether it's through these storms that are having these massive disruptive effects on people's lives, to air pollution and how climate change affects and changes the way air pollution affects our respiratory systems, or whether it's changes in disease vectors and disease outbreaks. Climate change affects all of us. Climate change is here, and its effects on human health will only accelerate in the years ahead. There is some good news in all of this. The good news is that there is a lot we can do. Certainly, we need to begin by getting out of our dependence on fossil fuels and onto cleaner energy. While that will have a direct effect on climate change, it will also have a direct effect on air pollution, a central part of what really drives suffering and death for people around the world. Second, we need to begin mitigation efforts right now. The bottom line is that climate change is here, and even if we were to switch to a carbon-free energy source immediately, the effects of climate change will be with us for generations. And so we need to make changes now to begin to solve and begin to minimize the health effects of climate change. And finally, what we need to do right away is to ensure that the healthcare system becomes part of the solution. Right now, so much of the healthcare system is actually part of the problem. A major emitter of greenhouse gases, a system that has not been resilient to the health effects of climate change and the other effects of climate change that will make it harder and harder to deliver high quality care in the years ahead. So the Lancet Countdown, a central report, a seminal report, lays these and other issues out in front of us. It reminds us that we're all in this together. And while we may all be in this together, we're not all affected equally, because these pernicious effects of climate change will most substantially affect those who are poor, those who are minorities, those who have fewer resources. So while we all have to work together for the sake of improving the health of the world's population, we have to do this particularly with an equity focus in mind, because it'll be the most vulnerable among us, the poor, the children, elderly people, who will be most affected. So I'm thrilled again to be a part of this important effort. Let's use this countdown, the data, the recommendations, to renew our efforts to get off of carbon-based fuels, to reduce air pollution, and to make health of people here and around the world a priority once again. Thank you so much.